So good afternoon, everyone. Let us start. Others will see the recording or they will join later on. So we were at last of our tubercular diathesis. We have seen that Robert have discussed SORA, then have discussed syphilis, then is discussing the combination of these two miasms, syphilis and SORA. This is the combination we often see in our patients. Okay, even Hahnemann have said that this combination of syphilis and SORA are more commoner than combination of SORA and psychosis, or rather all three miasms. Okay, that is why later authors have developed and elaborated this tubercular diathesis, and some have gone to such an extent that telling this tubercular diathesis is nothing but a tubercular miasm. Okay, let us start. So we are in the final discussion of our tubercular diathesis. Okay, we have stopped here. I will read. Cons and like hypertrophies are tubercular manifestations. Cons and like hypertrophies. Cons and like, what are the like hypertrophies? Means con like hyperkeratosis, callosities of the skins are being called here tubercular manifestation. Okay, though it is an deposition and induration, still it is not syphilitic or rather tubercular diathesis. It is of tubercular diathesis. Okay, this is exception. Remember it. Okay, this has often been a question in our examination. According to Robert, this are which kinds is tubercular. Okay, boils are usually soric, but when there is much suppuration and pain, it is the soric and syphilitic manifestations. Okay, so remember this, boils are usually soric. All of the other that it is not, it should not be encouraged to name a disease and name a miasm. Like we have named a disease and named a disease tubercular diathesis. That diabetes are always of a tubercular character. Okay, this has not been encouraged by many of our teachers that do disease and attach a with that, or attach a diathesis with that. Clear? So for your understanding purpose, like in diabetes, we have differentiated that those diabetes which are occurring in young ages, young persons, are rather a kind of syphilitic predominance, and those which are occurring at later ages, a kind of soric predominant. But those those you can say at any age, psychotic can develop at any age. So this is rather a tubercular manifestation, and manifestation is occurring according to ages. Next, see the site of affection. Okay, if this is happening on a sphere, if a tumor, we are generally thinking of psychotic nature, but if a tumor is occurring in brain, if a tumor is occurring in a spinal cord, what is the area of affection? If the tumor is meningioma, if the tumor is occurring in meninges, what is the area of affection? Area of affection is syphilitic. So this may be called a syphilitic predominant. Okay, so why we are trying to classify diseases as we have classified miasm? Because of easier, it will be easier to get the medicine and easier to plan our treatment. Okay, so we are not going to attach a named disease with a named miasm for the purpose of we can call for the purpose of prescription, but we are trying to locate the predominant miasm so that we can plan our treatment. Okay, so it is much suppuration and pain is usually a combination of the soric and syphilitic manifestation. It is characteristics or soric eruption that they tend to dry down and scale off rather than suppurate. Okay, they may be, soric eruption may be somewhat moist, as we have seen in the organ of medicine. A moist primary manifestation, there was some sort of moist, but usually the soric skin is dry. Okay. However, the appearance of boils after the administration of antisoric remedy is a welcome and encouraging indication. You have given a medicine and there is boils. Okay, there is boils. So this is a welcome indication. Any sort of external manifestation, any sort of external symptom after the prescription of your medicine is a welcome sign. Okay. Now, children who have weak wrist, this we have discussed during discussion of syphilitic miasm, that wrist and ankles who have difficulty in holding an object, who drops things. Now, this drops things may be due to awkwardness. There is a rubric in the repertory, awkwardness. Okay, due to mental weakness. Okay, due to mental weakness or some sort of hysterical symptom. Suddenly, out of sudden, they may have a petit mal convulsion. They may have small convulsion, sudden out of senses. Okay, in this thing, they will also drop things. Okay, so this dropping of things, awkwardness, you will get a rubric in your repertory, awkwardness. Okay, and we are saying that this awkwardness should be in mind chapter. Okay, there is a rubric in Kent's repertory, awkwardness, awkward. Okay, and you will find it in chapter of extremities, awkward, chapter of extremities. But during our discussion in repertory classes, we used to say that this is a this is a demerit of Kent's repertory. A rubric which should be placed in mind chapter have been placed in extremities. But we need to know that why this rubric has been placed in extremity. Okay, because this awkwardness, this dropping thing may be due to the tendons, weakness of the tendons. Okay, weakness of the joints, weakness of the wrist joint. Okay, so this is this will become a local symptom of the extremity. How can you put it in mind? Okay, so this awkwardness may be due to mind, a sudden out of senses, blackness of senses, suddenly episode of convulsion was there, episode of unconsciousness was there, episode of petit mal epilepsy was there. So this things drop. So if things drop due to this, it should be kept in mind chapter. But if things are dropping, this awkwardness is due to the weakness of wrist joint, this should be placed in extremities. That is why Kent have placed this awkwardness rubric in extremity, chapter extremity. Okay, so children, we have discussed this con and like hypertrophies, first paragraph. Next paragraph onward, where we have left yesterday. Children who have weak wrist and ankle joints, we have discussed those ankle joints give away easily. You will get lots of medicine in your Allen's keynote that ankle gives away easily. Joints are turning easily. Patella are dislocating. Cannabis sativa, you will get the symptom in cannabis sativa. Patella dislocates. Okay, and in clinic you will get that mal chaka na ki bole banglate, this patella. Dr. Babu, amar mal chaka ta ghure jay. Ekdam mane knee is turning and the patella is dislocating. So this is a common weakness of joint, and this is of tubercular manifestation, and more predominantly of syphilitic. Though affection of joints, okay, arthritis, all sort of arthritis. When we are reading psychosis, we will read psychosis, we'll get arthritis, all sort of deposition of salts in the joints are of psychotic manifestation. But this sort of weakness of joint, okay, weakness of bone of the joint, weakness of the alignment of joint have 2-3 element in its construction: tendon, bone, ligaments. Okay, these weakness are of tubercular manifestation mainly, and more predominantly of syphilitic origin. So we have read and you will get lots of medicine in your Mathematica of weakness of ankle joint, Lidampal, carboanimelis, and lots of other medicines. Okay, those medicines which are covering, which are having a syphilitic base will be more indicated in these kind of cases. Okay, children who have weak wrist and ankle joints, who have difficulty in holding objects, who drops things easily, who are clumsy in getting about and stumble over straw, are manifesting the effects of the combined syphilis and psora. Okay, this syphilis and psora, for this combination affects the tendon about the joints by weakening them so that they will not stand the strain of much use. Okay, next, as we naturally expect, there are great many skin manifestations. As we naturally expect, there are great many skin manifestation with the syphilitic miasm. Rashmi, can you read for us?
Am I audible, sir? I think I have a network issue. Sorry.
Okay, you are audible. You are audible.
This para, as we naturally expect.
Yes, yes.
As we naturally expect, there are a great many skin manifestations with syphilitic miasm and in the tubercular dyscrasia. There are pustular eruptions which separate, and eruptions occur especially about the joints or in the flexures of the body. These eruptions are quite prone to arrange themselves in crescentic formation. In color, they are coppery or brownish, but sometimes very red at the base of pustules. The most striking characteristic of this syphilitic eruption is that they do not itch, and there is very little soreness. If these eruptions
Cicuta
progress
verusa.
to scaly,
Cicuta verusa. Eruption without itching. Cicuta. You get eruption without itching. Okay. They don't itch. Each miasm, psora is being called as each miasm, and each is very characteristics of this psora. So eruptions are there. What color of eruption will be? In tubercular, this ringworm like eruptions are basically tubercular. That is why we are often finding people are prescribing basilinum in this kind of eruption, ringworm like eruption. More psychosora and more, sometimes more syphilis and psora, combination of syphilis and psora. And this crescent shaped ringworm like is, what is crescent? Crescent is half moon shaped. Okay, one of the characteristics for this syphilis eruption, they do not itch, but eruptions are there. And what color it may be? It is if it is predominantly syphilitic, it will be having coppery colored. Okay, and in particular syphilis kind of eruption with a predominant syphilitic miasm, you will get a straight line of eruption. Okay, there are some eruption I have seen. They warts are arranged in a straight line. Okay, and that has gone with the remedy syphilinum. In spite of this, that these are the warts are syphilinum is working over there. Any linear pathology you will get, you will have an indication, you are having an indication for prescribing syphilinum. So if they are arranging themselves, eruptions are arranging themselves in a half moon shaped like crescent shape, or if they are arranging themselves in a linear fashion, you will get indication for syphilitic, anti-syphilitic medicine. Linear fashion, any linear pathology, you will get white spot in linear fashion. Okay, in syphilitic tongue, you will get linear cracked. Okay, if I got some that linear cracked in the tongue, I will show you. I will share the pic. So linearity, arranging in crescent, and right in the margin, arrange in linear fashion. Linear. You will get ilium cepa, where there is a pain, neuralgia in linear fashion. Okay, ilium cepa. You remember that linear neuralgia in a straight line. Patient will complain that I am feeling pain from here to here. Okay, this pain, neuralgia, linear fashion, same kind, linear pathology. Okay, linear, whether it is what, whether it's an eruption, whether it is white spot, if it is arranged in linear fashion, more than crescent shaped or crescent arrangement, you will see linear arrangement of these kind of eruptions. Okay. Next.
If these eruptions progress to scaling and crusts, as they usually do, these are very thick and occur in patches or circumscribed spots. The gangrenes of the skin and dry gangrenes show the destructiveness of the syphilitic stigma.
Gangrene is of course of syphilitic nature, gangrenes and dry gangrenes. Okay. I have shared a picture of a gangrene in an old lady, 95 or 94-year-old lady in the group. You must have seen that. And that was cured with sickle cor. Sickle cor is predominantly a psychotic medicine. Okay. But these features are of syphilitic. We have discussed that some medicines are having predominant character of a miasm that will designate which kind of medicine it is. Next.
Skin affections with glandular involvement are frequent. Occasionally, psoriasis shows itself. Psoriasis has been called the marriage of all the miasms or stigmata,
Underline
but
this. That
its
is why
characteristic
psoriasis is not a very easy disease to cure. Psoriasis has been called the marriage of all miasm. Underline this. Psoriasis is not an easy disease to cure. Okay, though it is on the skin, that is showing the vitality of the patient is still strong, but this is not an easy disease to cure. Marriage of all three miasms. Okay, next.
but its characteristics are predominantly psoric and psychotic. Another type of eruption where all the stigmata are present is the fish scale eruption. In this condition, we have the dryness of sora, the squamous character of the syphilitic eruption, and the moles and warts of psychosis.
Okay, a fish scale eruption, ichthyosis. Ichthyosis. Next.
Varicose veins are of tubercular origin. Varicose ulcers are the last destructive manifestation on the skin of the syphilitic tent. In this stigma too, we see
Underline
the
this.
ecchymosis.
Varicose veins of tubercular origin. Underline this. Varicose ulcers. In my initial practice, I have seen few cases of varicose ulcers, and people were treating it like any other skin eczema. Okay, many of the homeopath in nearby my clinic were telling patient without any management. Okay, without telling the patient this is due to varicosity of your vein. You have to put your feet above while sleeping. You have to use the stockings. Okay, these are the general measures you have to take whenever you are getting varicose ulcer. You need to identify a general eczema, differentiate a general eczema from a varicose ulcer, both from viewpoint of management and treatment. If it is a general eczema, this is showing a predominant psoric character, but it is due to, if it is due to a varicose ulcer, if it is ulcer, you need to treat it as it is, predominantly syphilitic character. Okay, for even if you are behaving as a homeopath, you need to differentiate it between the eczema of the sora and varicose ulcer of the syphilis. Okay, so that was few initial cases of my clinic which have given me some name and fame in the locality, because I have just simple thing. I have diagnosed that this is not a simple eczema, this is a varicose ulcer, and you need to put your leg upside. You need to adjust your occupation with this. If you are standing too long, the person were having happened to be a tailor, so I advise him like that, and this varicose ulcer were very easily means controlled with my medicines. What I have done, just differentiated between eczema and varicose ulcers, between syphilitic manifestation and psoric manifestation, and according to that I have given medicine. Open fluoric acid and get the symptom of varicose vein. Open fluoric acid in your Allen's keynote. Got it?
Yes, sir.
Varicose veins and ulcers. Huh?
Obstinate,
Varicose veins
long-standing
and ulcers.
cases.
Hmm.
Obstinate, long-standing cases in women who have borne many children.
Another was infectious. Means incidentally, another patient was a woman. Okay, of an old age. Both were prescribed fluoric acid depending upon other symptoms. The symptom will come. The means symptom of the medicine will come to you. First prescription, you may think of in this line that fluoric acid is an antisyphilitic medicine, and this is a syphilitic manifestation with the ulceration of the place, and we have to advise the management along with this treatment. Another, after prescribing first prescription, you will wait for other miasm to come to give indication. Okay, first prescription is always easy provided your understanding of disease is clear. Next.
In this stigma too, we see the ecchymosis and hemorrhagic conditions into the skin. Purpureal conditions are all manifestations of the syphilitic taint.
Underline this. What is purpura? What is the clinical manifestation of purpura? Bleeding in the interstitial spaces, causing ecchymosis, causing purpural. What is purpura? A short means ecchymosis. How to differentiate between ecchymosis and purpura? Ecchymosis is occupying a large part and purpura is occupying small parts. Basically, both are hemorrhage within the interstitial space. Okay, due to some imbalance in the clotting management of the body. Okay, so this purpural or ecchymosis, if it is occurring without any external factor, okay, without any external factor, you are getting these spots on the skin. This is purpura, or this is a defect in clotting factors or defect in platelet of the body, and this is a syphilitic taint. Okay, like we have told thalassemia, we have told pernicious anemia. Okay, this dyscrasia of the bloods, these are having a deep syphilitic origin. Underline this. Next.
Erysipelatous and carcinomatous conditions, epithelioma, and lupus are all manifestations of the union of three stigmata. In acute exanthematous diseases, we see the tubercular diathesis. These conditions show the sora in the severity of the attack, but the profound prostration from the lowered vitality is the mark of the syphilitic taint.
Next.
Urticaris occurred in the tubercular diathesis. Marked
What
freckling
is
is
urticaria?
also a manifestation.
Urticaria is allergic manifestation of the skin. Uh, Angioneurotic edema, urticaria. Okay. Allergic manifestation of the skin. Allergic manifestation, you may see it is a tubercular diathesis and allergic manifestation. Why I'm discussing this allergic manifestation? These you know, erysipelas, carcinomatous condition, epithelioma, lupus, or the cancer. Lupus is a tuberculosis of the skin, are all manifestation of union of all three stigmata. Okay, so these need not to be discussed. But urticaria we get in common practice. Urticaria, people will come with these thing that this इसको पित्ती बोलते हैं आम लैंग्वेज में. You will heard that डॉक्टर बाबू पित्ती चले एसছে पित्त হচ্ছে ये करके. इसको आम लैंग्वेज में हिंदी में भी पित्ती बोलते हैं, बांग्ला में भी पित्ती बोलते हैं. So these urticarias are common manifestation of the skin. You will get allergic rhinitis, allergic manifestation of in two forms, either allergy on the skin or allergy on the nasal mucosa. Allergic rhinitis or this urticarias, both are tubercular origin. Both are of tubercular origin. Rather, urticaria are easier to treat. You will find that urticaria in clinical practice, urticarias are easier to treat, while allergic rhinitis are difficult to cure. Why? In urticaria, it is showing the place of occurrence of this allergy is showing that the vitality is strong. So it is easier to cure. Cure will be dependent upon the strength of the vital force is still present. Getting me? Both are allergic manifestation. One is showing itself on the skin. One is showing itself in the upper respiratory tract. Okay. Again, you will get allergic manifestation of the eyes. Okay. Again, you will get allergic manifestation which is causing breathing distress. Getting me? All these are what? All these are allergic manifestation. You can diagnose it with a single report of IgE increased in all these. Okay, but the site of affection is determining the vitality. Okay, one is affecting the skin, strong vitality. That is why it is being affected. Skin is the most means harmless organ to be affected first. If the vitality is strong, it will push it to the skin. Next, the upper respiratory tract. Okay, difficult to cure. Breathing distress, asthma due to allergy, difficult to cure. The redness of the eye, conjunctivitis. You will get spring conjunctivitis often in children. These are of tubercular diathesis and very difficult to cure. You will see this is not a common conjunctivitis. It won't go. Okay, there is a red spot on the cornea. This is also allergic sort of thing. Conjunctivitis, recurrent conjunctivitis, allergic sort of thing, difficult to cure. Where it is affecting? It is affecting the eyes. It shows a predominant syphilitic tint. Okay, it shows a predominant syphilitic tint, plus the area of affection is showing that vitality is low. That is why it has gone up to eye. Okay, so these are in order of difficult to cure. First skin, upper respiratory tract, then lower respiratory tract, then eyes. Okay, next. So the knowledge of miasm is always helping us in prognosis a case. Next.
Marked freckling is also a manifestation of tubercular diathesis. This has the clear, almost transparent skin of the tubercular patient with, with the pigmentation of the sodic. Impetigo, impetigo will readily
You have
develop in the
read
combination.
this Scrophulus diathesis? Scrophulus diathesis?
Yeah, glandule.
Articaria, after articaria, the Scrophulus diathesis.
It isn't here, sir, in my book.
Okay. What is there?
A marked freckling.
Okay, marked.
Marked freckling. Freckling
Okay, next. Okay,
is
next.
also a manifestation
Freckling.
of tubercular.
Okay, freckling.
Yeah, freckling.
Mm-hmm. Mm-hmm. Next. What is
Impetigo
freckles?
will wrinkles type.
This is discoloration. Brownish discoloration you get in lachesis, open lachesis. Freckles of the skin. Second line, third line, women of choleric temperament. What is choleric? Anemia. With freckles and red hair. Freckles. You will get brownish spot here and there. Brownish spot here and there. If it is on the cheeks, it is indicating of sepia. Okay, but freckles here and there you will get in actual practice cases of freckles. These are of tubercular manifestation. Okay, next.
Impetigo will readily develop in the combination of the sodic and syphilitic stigmata, while those without this dyscrasia will not become infected.
Next.
We
Impetigo is a
often
boil
find
disorder of the children, commonly of children. We have discussed in previous classes. Next.
we often find patients with slight wounds that heal very slowly or not at all. This condition is due to the union of syphilitic and sodic influences. In this same category, we may place the stitch abscesses which occur following operative measures. In
You have,
hospital,
I think you have gone to, I think you, your page have been, means I have having printout of this. I am not having whole book with me. You have gone to next chapter. I think this is,
Oh.
you just have gone to next chapter. This is
It
psychosis.
is in different para, sir. Scrofulous diathesis.
Ah,
The scrofulous
you got
diathesis
the scrofulous
manifests itself
diathesis?
largely.
You
Yeah,
got
it's
the
in.
scrofulous diathesis?
Yes, sir.
Can you share the video of your book where we are? I cannot recognize it. Actually, I have just a printout of it. I don't have the book here with me.
Hmm. 1 minute.
Okay. This para we often find, no, we have spoken a great deal about. You are reading this. We often find patient with slight. Okay, next. You are reading this. We have spoken a great deal of tubercular diathesis. Please read from there. Your mic is off.
Sorry, sir. Mm, This one. We have spoken a great deal of,
Yes, yes.
of the tubercular diathesis as being a combination of the syphilitic and soric stigmata. The scrofulous diathesis is also a combination of these two stigmata, but it differs in the proportionate degree of the presence of tents and is further influenced by the suppressive measures of crude drugging. Probably environment and circumstances have some bearing on it also. However, the suppression is a strong factor in its individual expression because this has buried it deeper in the system. Then it is
Scrofulous
this.
diathesis is another condition. Scrofulous diathesis. What is scrofula? According to Hahnemann, scrofula is sora and sora is scrofula. Scrofula is actually the affection of glands. You will get glands of anywhere, lymphatic glands of anywhere. You will get in scrofula actually the affections of gland. Okay, uh, in sulfur, Allen's keynote, in sulfur you will get scrofula. In many other medicine, scrofulous diathesis is a common term being used in our medicine. But what is scrofula? According to Robert, it is combination of sora and syphilis, where the particular affinity of the this affection is glands. Okay, but according to Nash, scrofula is sora and sora is scrofula, and we need not to discuss and begin an argument what is scrofula. Okay, we need to know that scrofulous diathesis, where it has been used in our literature, it indicates the affection of glands. Okay, the affection of gland, and we are telling this affection of gland is combination of sora and syphilis. Okay, combination of sora and syphilis. Nash is saying that scrofula is sora alone, and at many places in Hahnemann's writing you will get sora and scrofula mentioned together. Okay, but for all our practical purpose, scrofula is the diathesis where particular affection is of gland. Okay, next. Your mic is off.
Sorry, sir. The scrofulous diathesis manifests itself largely by the involvement of the glandular system, particularly the lymphatics. While many authorities have classed scrofula as soric, its relation may be traced by its manifestations. Sora has no glandular involvement, but syphilis has a particular affinity for glandular tissue. Scrofula has many
Underline
symptoms
this.
in common with Sora.
Underline this. Sora has no glandular involvement, but syphilis has particular affinity for gland. Okay. Whenever you are being asked, particularly in your MD examination, you will be asked that what is scrofula, what is Sora, and how you will tell that this Sora is not scrofula. So Sora has no glandular infection, but syphilis has. So this is the combination of Sora and syphilis. Next.
Scrofula has many symptoms in common with Sora, but it has the same tendency to ulceration as syphilis. This relationship may be seen also in the purulent discharges and decomposition of the exudations. Scrofula has the same
Next.
tendency as syphilis to locate in the organs of the special senses, such as the eyes, ears, nose, lips, etc. The pernicious anemia of the scrofulous patient resembles very closely the syphilitic parent and shows its kinship to the tubercular diseases.
Pernicious anemia we have already discussed. This is a syphilitic tent. Pernicious anemia, underline this. Scrofula has the same tendency as syphilis to locate in the organs of special senses. Underline this. Organs of special senses. Auditory canal is being affected in syphilis. Eyes are being affected. Nasal bones are being affected. Okay. So scrofula. Anemia is scrofulous. Pernicious anemia of the is of syphilitic tent. So we ended our chapter here. Next chapter you will see. In next chapter, you will actually see again the Roberts. This go to next chapter and see what Robert is saying under the heading of syphilis. Syphilis is first. Read the first paragraph. Read the first paragraph of next chapter.
Should I turn on the video also, sir?
No need. Just read the first paragraph.
We have spoken of the soric miasm as being closely related to the deficiency diseases, so-called. Now, on the same basis of the table of atomic weights in relation to disease conditions, we are considering the problem of venereal taints, syphilis, and psychosis. Just as we find the remedies preeminently antisoric in the lower register of atomic weights below 53, and just as we find these closely to the constructive elements in living tissue, so we find the elements with the highest powers of destruction in the upper and highest registers of atomic weights.
Okay, underline this. See, what Robert is trying to correlate is those elements which are unstable, like in the higher part, okay, are more heavy metals like gold, silver. These are predominantly anti-syphilitic medicines. Okay, in the higher atomic weight are more toward going toward more instability. Okay, those who are more destructive, carrying the more destructive. Constructive was being used as antisoric, and those which are going toward more destructiveness are being used as antisyphilitic. Okay, aurum, mercurius, these are heavy metals. Okay, and carrying a hallmark of antisyphilitic medicine. Just it is an interesting point to keep in mind. Okay, we are not going to apply our medicine according to periodic table, but this is an interesting point to keep in mind, that those which are constructive element of the life are used as antisoric medicine. Those who are carrying the destructive element of the life are being used as antisyphilitic medicine. Okay, and antipsychotic are in between. Read next. Next lines.
It is to be remembered that the constructive elements are as Millikan states in their state of maximum stability already. They have no energy to give up in the disintegrating process. They can only be broken apart by working upon them or by supplying energy to them. However, when we consider the radioactive elements, we find the problem an entirely different one, and necessarily there hemopoietic field of action will be different. We cannot expect construction from essentially destructive forces so long as they remain in their natural state. Millikan tells us
Next.
that the process of Millikan tells us that the process of radioactive disintegration is a process that can take place only in the case of a very few of the very heavy elements. That radioactivity is a heat evolving exophthalmic process, that it is self-destructive in that it gives off of itself in the process, and after this process has continued a sufficient length of time, the original substance is itself changed. It has become more inert and has less and less radioactive properties and powers. We are told that uranium, after it has discharged its alpha particles for a considerable period of time, geologically considered, has become so much lighter in atomic weight that we recognize it as thorium. This eventually is worn down into radium, and this in
Leave
turn
it. There is
disinterests.
leave it. Leave it. There is no mention of hallmark of diseases like Sora is functional, psychosis is induration or deposition, and syphilis is destruction. There is no mention of that. Okay, leave it. So the main point of discussing this chapter was just it is interesting to note that those who are destructive element, which are unstable element, are being used as antisyphilitic medicine, and stable medicines, stable element are being used as antipsychotic medicine. Okay, and next you have to make means to gain the power from those, just like natramure. You cannot, this is a stable compound. Natramure is a very stable compound. To gain the energy from this, you have to make it unstable, means make it potentize, so that energy can be released. So natramure are better used in higher potencies. Okay, but those which are radioactive elements are maybe used in lower potency, because these are already a very, just say people are using uranium 3x. This is not in higher potency, but it is being used in lower potency, and this is unstable. It is being used as medicine in allopathic school also. Uranium may be used in as medicine. Because of this means destruct, means because of this energy, they are giving energy very easily, but those who are unstable compound are giving energy only after potentizing it. Okay, like saccharum lactis is a medicine in our materia medica, glycerin is a medicine in our materia medica, and can be used after potentizing it, not in normal form. Okay, you will see that many spring water are being used in our is our this, what medicine it is, uh, which medicine by spring water in Aaron's keynote, this medicine, uh, wait a minute, I will tell you. Sanicula. What is sanicula? It is a mineral spring water. So these are the inert substances being used, and these should be potentized to the level so that we can get energy from this. Okay, we have finished our syphilis discussion on syphilis, sora, then syphilis, then tubercular diathesis. We will start next day from psychosis onwards. Please keep this chronic disease of Hahnemann with you. Okay, the theoretic part, chronic disease of Hahnemann with you, the theoretic part at least. Not practical part is not necessary. We will discuss some point from them from there. Any question you are having till now, you can ask. I hope you are understanding miasm. It is easier to understand miasm now, and you can read Hahnemann's chronic disease easily after this if I ask you to read. Any question you are having, you can ask. Just one miasm is remaining. Yes.
No, sir. No.
Okay. Just one miasm is remaining. That is psychosis. And after that, we will read the treatment part from chronic diseases. Okay.
Okay, sir.
Okay. Thank you very much for
Thank
giving
you,
your
sir.
attention.
Thank you, sir.